First of all, let me say, you're not going to have any type of a evacuation plan or rebuilding plan if you do not include the people who are being affected. And that is one thing that I had hoped that we would see and would have learned through Katrina. But as we have seen in the last, as Courtney stated a minute ago, as we have seen in the evacuation plans and so forth, they have gone a bit smoother. But those who need assistance more, and those are the individuals that we deal with, people with individuals, senior citizens, people with chronic health diseases and so forth, they are not, and their organizations that deal with them are not included, not only in planning, but also in recovery. Recently, I heard a senator from the area state that Katrina was an equal opportunity storm, and it was an equal opportunity storm, but recovery has not been equal in any shape, form, or fashion. Yes, there are many people who are staying in different areas, such as that left and went to Houston, which in different areas, mainly because there's no housing, especially in Mississippi. And I just wanted to read you some of the facts here. We evaluated at the 2 years after Katrina to look at the federal mandates and to see what we had been doing within the areas, and particularly Mississippi. And we found at that 2-year juncture that the funds had been redirected, over 75% of the federal funds that were designated to lower income storm victims, to other uses rather than what they were to be used for, paid nearly all of its disaster funds to date to wealthier homeowners, utilities, and insurance companies, spending over 13% on lower income persons, and risk violating fair housing laws by implementing programs that disproportionately underserve lower income and minority storm victims. Now we're at the 3rd year, and we've also done another report card, and we have found that Mississippi still has over 75% of its programs exempt from income targeting, has spent only 13% of its disaster funds on lower income storm victims, and lags badly in creating and implementing the programs designated to serve housing challenged storm victims. We have totally neglected the renters. Rental housing that was affected by the storm is not being rebuilt. Much is being torn down, both in Mississippi, Louisiana, and what was affected in Alabama also. People cannot find housing. If there is housing, it is way, way, way too expensive. We have people walking around with vouchers because they cannot afford to make the difference up. There has got to be, something has to be addressed when it comes to the CBG grant funds. They were intended to come to your state or your general areas, and your governors are over these funds. But there has got to be a portion, something in this procedure that allows for more transparency, not necessarily to tell you what you can or cannot do with it, but there's got to be more transparency. There needs to, the waivers for these HUD's funds needs to be addressed. Our state received many waivers on our grant funds through HUD, and these funds have been directed, as I said a moment ago, to other areas, such as roads, and we're looking at a port issue and so forth, and we've got hundreds and hundreds of people who do not have affordable housing and will not have affordable housing. But the major thing is that we have got to include these populations in the planning. We've got to include these populations in all aspects after the storm, before the storms. Here we are, 6 months only remains, and the FEMA housing assistance terminates. So, what are we going to do? These people are being asked to move out of their FEMA trailers, and the monies that we did have were not directed as they were supposed to be directed. So we're having to come back and ask for more funds, but we want transparency in these funds, and we have got to have assistance for us to rebuild. We have to remember that this was I know everybody has Katrina fatigue. Even in Mississippi, people north of Jackson will say, isn't everybody down on the coast? I mean, they should pull themselves up. They should be doing things for themselves, but we're talking about the most vulnerable populations here. And if you don't give them the tools and the information and the education for them to be able to recover, then you know, they cannot do that. We continue to hear that government should not be so large, but yet government is wanting to tell them what they can do and what they cannot do, not knowing what they are capable of doing. And I just have to state that I do not know where we would be today if it were not for the faith-based and nonprofit organizations. We would be in a terrible fix right after the storm and even today if we did not have the faith-based. And that's a portion of what we need to do. We need to have the faith-based and the nonprofit organizations as part of these efforts. But they need to be included at the beginning in the planning efforts also, so that we have a plan and these plans take place and we can help individuals. Mental health is a huge issue across the region, and particularly in Mississippi. In Hancock County, the suicide rate is up 300%. Studies show us that this period right now is the most important period in addressing mental health issues, and we do not have true mental health care in these regions. We have what we call cattle calls, where you go in, someone sees you, write your prescription, that's the end of it. We need long-term counseling. Children need long-term counseling. We are seeing that we're having more and more suicide rates among adolescents and students. We are working on projects now, working with students with disabilities who have communication issues, to have them have a way of expressing what their concerns are and what their depressions and what they've been going through, because they have not been addressed. We've got big issues.